যদি তোর দাগ শুনে কেউ না আসে তবে একলা চলো রে যদি তোর দাগ শুনে কেউ না আসে তবে একলা চলো রে তবে একলা চলো একলা চলো একলা চলো একলা চলো রে তবে একলা চলো একলা চলো একলা চলো একলা চলো
Hello everyone, welcome to the Pearl Cruise Show by NXL. And I don't think the personality on my screen needs any introduction. You type Abanti Gopan on Google and it gives you everything that ma'am has done throughout her life. A strong advocate for the nursing field, a great healthcare professional, an NABH assessor, and now an independent consultant. Welcome to our show, Abanti ma'am. It's my pleasure to have you on my show.
Thank you so much, Pearl. It's a pleasure on my part also to be with you. I've been watching your podcasts, so it's very interesting. Very good.
Thank you. Thank you so much, ma'am. A lot of viewers don't know this, but about 10 years back, I was planning to write a book on nurse leaders of India. And I had messaged few of the nurse leaders back then. That was in 2014-15. Abanti ma'am was one of them, and we had a very long conversation at that time. Unfortunately, I could not finish that book, hoping it will soon be done. But I thought podcast is another way of sort of bringing out, and having said that, the new generation prefers watching over reading. So I thought this is probably the best way. So remember about 10 years back when we were talking about the nursing care in India, the future of nursing, you had told me that when I asked you, how do you view the future of nursing in India? Back then you told me that, well, I think nursing is headed to the dark ages. Quite a valid point back then. And I was wondering, do you think you have the same opinion now? You have witnessed a lot of significant changes in our profession. You have about 4 decades into the nursing practice. So do you believe that India has truly progressed into the nursing industry? And how do you compare this progress to the global standards, particularly in the Western world?
Okay. Yeah, I'm almost close to 5 decades into nursing.
Wow.
Yeah, just 2 years short. But yes, my answer would be yes and no. Let's say that why it is not into dark ages. Let's look at the positive side first. Yes, there have been a lot of improvements in the area of technology. The number of nursing institutions, educational institutions, a number of hospitals, especially all over the country, have largely increased, which makes it much more demanding for nurses to work. And technology has improved. Nurses are very tech savvy. The young nurses who come today, they are already tech savvy. So, that's half the battle won in today's world. So in those areas, yes, we have made a lot of progress. A lot of new programs have come up also, specializations and, all these doctorates. Number of doctorates in nursing is huge today.
Yes.
And another positive is that many earlier days, postgraduates and doctorates were very few. Postgraduates were all into the academic field. But today, what is a positive side is that there are plenty of postgraduates opting to work in the clinical field, which I see as a very positive move, and it's much required. Much required. We need postgraduates and doctorates to be the face of nursing, the face of healthcare in the clinical areas, be it in the community or be it. So that's happening. Yes, that's a very positive move. And why I would say negative is that though we have increased the number of educational institutions and all, the kind of, because see, it's always a battle between quality and quantity.
Absolutely. Yes.
So when we need the quantity, of course, but whenever we start expanding the quantity, somewhere, something, the quality gets affected. I think that has happened. And the kind of preparation that nurses come out with, the young nurses, no fault of anybody, it's the whole system. The kind of nurses that come out, they come out with the preparation, because see, the large number of students and the clinical areas are limited.
Right.
So their access to clinical area, their access to patient care, the supervisor's access to individual students, all these are in a way, I would say, compromised.
Right.
Because see, in our days, it was limited. We had just 30 or 25 students in one batch,
Right.
strict 1:8 ratio. In every ward, we had one clinical instructor. My first year students, you all know very well, Dr. Bimla Kapoor and Dr. Asha Sharma. They built our foundation, and they were almost hand-holding us for everything. I still remember the first injection, and we had those crystalline penicillin those days,
Yes.
which
Yes.
used to get stuck in the syringe, and that was a
Yes.
real phobia for me. You have to give CP. Oh my God. And and my hand would be shaking. And there, Dr. Bimla Kapoor, she would be very young that time. She must be hardly 4 or 5 years older than me, very young. But the way they held fort, the respect they commanded, they walked into Safdarjung Hospital and everyone respected them. And that kind of an environment I don't see nowadays, especially in government hospitals, in the not the see, we have two Indias, you will agree.
Yes, absolutely, ma'am.
Healthcare system also has two systems. We have the private 5-star, 7-star hospitals, and we have the other 2-tier district hospitals. So there lies the difference when I say that yes and no. Yes, the private hospitals have really emerged very far ahead, but the other 2-tier hospitals, as NABH assessor, I have visited vast number of hospitals, and some things are quite shocking. Some practices are quite depressing, I would say. Facilities provided for nurses, the resources not available for adequate nursing care, all these things are far from right ages. So there is a lot of scope and lot of need for improvement.
Yes, ma'am. I totally agree on what you've said, because when I almost about 2 years back, when I moved over here, as a nurse back in India, I used to take a lot of pride in how far we've come. A lot of things, a lot of roles for nurses have emerged. Nurses have risen up in India up to the CEO, COO levels, are independent practitioners in some areas. But when I came down here, what I realized was there were so many niche fields of nurses that they were independently practicing in. And when I say independently, I don't mean that they have their own clinics or something like that, but she or he is a very, very important member of the healthcare team. The way the nurse can confidently say, yes, I think we should do this, or no, I don't think we should do this, and how she is respected by the other fraternity, and how everybody is responsible for their own bit. Because when I see in India, what happens is the nurse is at the center of everything. She's supposed to do everything. Patient ka khana nahi aaya, nurse call karegi. Doctor nahi aaya, nurse call karegi. So everything is held on to her. But when it comes to giving her the right, you say, respect, or the yes, decision making, I think that is where we somehow lack. And what I realized here is she's just responsible for her bit. And in the hospital, in the trust that I work, when I was reading about it, I realized there are 350 different roles of nurses. Now, the hospitals that I worked in, when you say two Indias, I worked in very good corporate hospitals. I did not see 350 roles of nurses. Of course, yes, this hospital is way, way bigger compared to those hospitals, having said that. But I think somehow you're right. We have a long way to go. And I am hoping with nurse leaders like you, we will definitely move ahead. So thank you for very, very honestly responding to that question, ma'am. The next thing I was wanting to know is, as the healthcare landscape of India is sort of changing, and we've heard a lot about the advanced nursing programs, like the DNP program that's coming to India, the nurse practitioner. I've seen two universities giving these programs out, so that it helps to shape the future of care for the patients and also the professional growth of the nurses. What do you think are the key challenges in implementing and integrating this whole new roles of nurses into the Indian healthcare system?
Yeah, we have actually, see, we always try to follow what the Western world does with all good intent,
Yeah.
you know. But somewhere down the line, we are not able to implement it, or the outcome is not as successful as the intention is. So there are Indian Nursing Council has approved plenty of nurse practitioner courses. The critical care nursing course is the most popular.
Yeah.
There are about 31 colleges across 19 states
Wow.
in India where this course has been run, approved by Indian Nursing Council. And nurse midwifery course, nurse practitioner in West Bengal, it was started long back. Then it was stopped because they did not get the opportunity to practice as a nurse practitioner. Now
Right.
again, it has restarted. In West Bengal, I think very few numbers, maybe just a couple of them are working as real nurse practitioner, where they do everything right from giving episiotomy, suturing, conducting the delivery independently, referring the patient in case of complications, and the whole the whole paradigm is taken care of by the nurse practitioner. But how many? Just very rare, very few. And in West Bengal, we have a couple of them in the district level. The district level. In the hospitals, in the private hospitals, registered nurse, registered midwives are not allowed to perform normal deliveries.
Right.
So where is the scope for nurse practitioner in our country, you tell me? Even the critical care nurses, very few hospitals are actually giving them the scope of working as a nurse practitioner. They pass out and then they work as maybe physician assistant. I don't know why they should work as a physician assistant, where even, I mean, as a staff nurse, I will have much more autonomy. And
Yes.
if you really ask me, what is our Masters of Nursing program preparing us for? It's the specialization, and we are
Yes.
supposed to be masters in that
In
field.
it.
And I have always been in the clinical side or carried out a dual role, teaching and this. So a master of nursing is as good as a nurse practitioner, because in many places some of the subjects are taught jointly, except the pharmacological part, which is taken up with much more in depth, but the other things are taken up jointly. And as a master of nursing, I have always felt, even when we had the CVT specialization course, which we started in BM Birla, the first CVT specialization
Yeah.
course approved by Indian Nursing Council, 1-year course.
Yeah.
Those nurses were actually functioning like nurse practitioners. We used to say it's a nurse-led hospital. The ICU, the critical care unit where cardiothoracic surgical patients came, we had, of course, standard protocols, but
Yeah.
everything was managed by the nurses. And only if there was a crisis or complication, we would have the medical or the surgeon stepping in. So that kind of an environment needs a lot of acceptance from the medical fraternity. And there lies the challenge in implementation, because the medical fraternity, they are happy to say physician assistant and then make them do everything. Why can't they accept them as a nurse practitioner? And the next thing is, of course, the amount of the remunerations that they get are not really matching to the nurse practitioner level as compared to the Western world. So these are some of the things which demotivate people. And maybe except critical care nursing, I don't think nurse anesthetist course has been, the syllabus is all ready. I don't know anyone who is conducting that. There is pediatric child health nursing, and there is geriatric. All these syllabi are ready with the Indian Nursing Council, but I'm yet to know, I may be wrong, if anyone has implemented them. The first thing is not only acceptance from the medical field, acceptance by the public, acceptance by the Indian public, because in India, the doctor is the last word. So
It's true.
these are two challenges, but the nurses are, once they are going through the syllabi and they go through the course, they can do wonders.
So you feel that the curriculum that's designed is going to enable them to perform to their top of their license.
Definitely, it will enable them, but acceptance has to be there. They must be given that much empowerment that they really function as a nurse practitioner.
Right. Right. So that means we do have to make some probably policy changes at the government level also. And I think, like you said, we have this
Private
mix of,
hospitals, most
yes,
of these
that's
are
what,
done by the private hospitals. So
yes,
in the private hospitals, the kind of patients at the two Indias.
yes,
So at that end, the upper end of India comes to private hospitals, and
yeah.
those patients are very reluctant to
Mm,
accept nurses as a nurse led. Though in BM Birla, I have not faced that. We got a lot of appreciation, a lot of recognition, and yes, I was at least very fortunate to have a team of medical and surgical doctors who really accepted. But I also feel it's two sided. I mean, we have to earn that respect. We have to
right.
command that respect. We have
Right.
to be knowledgeable and clinically competent. Then that will come.
Then I think then the nurse leaders have a much more bigger responsibility to make sure that the nurses are really competent enough to earn that respect. And I do agree, ma'am, when you say that in those days, I've heard so many stories when the nursing, a simple matron or in charge of that unit, when she used to walk in, how much respect she used to command because she used to carry the baton in her hand. This is my unit, and this is what will happen. Gradually, what I also feel is probably, I think, I've always seen that in the 40%, this is the statistics, ma'am, 40% of our early career nurses from India move abroad. And I think nowadays what happens is when it comes to the nurse in charge or team leaders, we have very young nurses taking that charge, Maybe, yeah, that's the reason why they're not. Exactly, exactly. And I mean, yes, it's nice, like to go abroad, experience the different world that's set for nurses around. But I think somewhere as a country, we need to build these systems for our nurses to stay back in our country as well. Moving on to our next question, ma'am. So, since the Nurses Day is here, and we've known that last year, the theme for International Nurses Day was the economic power of care, which highlighted the need for our governments to invest in expanding and sustaining the nursing workforce. Now, with the passing of the NMMC bill in India, India has ambitious plans for the nursing reforms. This year's theme, we know, is caring for nurses strengthens the economies. So, in continuation to that conversation, do you foresee any tangible policy shifts or progressive moves in this regard?
Progressive move, as I said, that even at the central government level, in most of the aims like organizations, the number, I think last year it was announced 119 nursing graduation programs were started. Right.
Right.
So that's definitely a positive move. And that is investing into nursing colleges, building a nursing college, staffing it and getting students. That's a huge investment. Government has done quite a lot. Central government, there's a huge rush for central government jobs because they have really invested in nursing. And most of the private organizations face the brunt of it because every time there is a selection, a huge exodus takes place, state government, central government, and the army. So these areas they have invested. But again, as I say, in the private organizations, there is a number shortage. Today, we are focusing so much on capturing indicators,
Hmm.
errors, and indicators. And if you boil down to it, most of the things come down to a mismatch of nurse patient ratios. And as nurses call it workload, I really don't believe that our work is a load. It should be work joy. But anyway, they are overworked, I would say. And so that there, I think investing the kind of resources that are provided to them, simple things like hand washing facilities. Again, I'm not talking about the high-end hospitals. I'm
Right.
talking about what I have seen in majority of the country. The hand washing facilities, a simple thing like their change room facility. You're talking about invest in nurses, give them the privilege of having a comfortable room where they can change into their uniform. Even that I find is very much compromised, and that comes last. Many organizations, I find that the nurse leaders don't have privacy where they can counsel their staffs or an office. These are investing into nursing. And one of the administrators once said, you invest in one strong nurse leader, the rest will be taken care of. I agree to that. If every organization invests in one strong nurse leader, build on that, she should be able to take it on. When they say that we don't get this, we don't get that, I don't buy it. I mean, you have to be strong enough to get that for your staffs, get that for your nurses. So I know it's not easy. It's not easy at all, and every battle cannot be won. But
Yeah.
that doesn't mean you will not fight for it.
True. So, is there anything that the government is thinking of, ma'am? You did tell us about the number of nursing colleges coming up, so that we increase the number of nurses in the country. We will increase the number of nursing colleges, but do we have so many takers for nursing? That was my thing. How do we make this thing that where nurses get and people do choose nursing as a profession, unless we make a better quality of life for them? The return on investment is better. So, is there anything going on that aspect?
As I said, that the returns only in, see, there should be creativity in the positions. At least I know that in the government sector and state governments, it's still the traditional position, staff nurse or what in charge, things like that. That at least in the private sector, we have plenty of innovative positions created by dynamic leaders. Some of the names you mentioned, and even way back 20, 30 years back, we had created, positions so that nurses can fit into that according to their capability building, according to their aging factor, because you need to retain aging nurses. There's a lot of
Mm.
wisdom, and experience counts. Experience
Yeah.
is like a mobile library, so you don't want to lose them. So but you can't expect them to do that heavy work anymore. So you have to create some positions where you can still get their expertise, and they are there as a strong backup. These kind of things are, I don't see visible in the central government and state government hospitals. But in the private sector, yes, we have moved
Yes.
ahead in
Yeah.
that area.
Mm.
Yes, and the number of colleges have increased. Takers are there, but higher level, again, higher level, I find the postgraduate, many seats go vacant.
Mm.
Number of colleges, all the colleges have post graduation, but there are
Mm.
so many seats going vacant. Yeah, there is one point I want to bring up here, is that this non-attending nursing courses, it's a disaster. IGNU was different because that was a very strategically planned open end university program where post basic BSc was run, not the
Right.
basic BSc. But when
Correct.
basic BScs do non-attending courses, there lies the problem.
I thought the NMMC bill addressed these issues. Of course, it's not completely into action now, but did it not address all these aspects of the nursing ratios, the newer roles for nurses?
They have addressed it, but
Yeah.
we are yet to see the outcome.
Okay, moving on to something slightly different. You had shared some pictures with me, which of course we'll be seeing over the course of this interview. There's one particular which caught my eye of Mother Teresa. You know, what's the story behind that? You did tell me she had come down for a procedure over there, and then what was your experience and interaction with such a beautiful personality?
Mother Teresa was admitted in Birla Heart Research Center. She had chest pain. Okay.
Hmm.
So when she had chest pain, she was admitted, and I was immediately I got a call, and it so happened that it was in Birla Heart Research Center. So Mr. GP Birla, who was then
Hmm.
the owner, Mr. GP Birla and Mother Teresa were both admitted at the same time.
Oh.
72 hours non-stop I was in the hospital, along with all the senior staffs that I had.
Hmm.
And both of them were in the two rooms side by side. So that was a very challenging time, two VVIPs at the same time. Now, Mother Teresa was very humble and very soft spoken, very soft spoken. Now, what happened is that she had to have an angiography done.
Hmm.
Angiography followed by angioplasty if required.
Right.
So it was, everything was planned, and in the daytime, like any other patients, it was during the busy daytime and all. Angioplasty, the angiography. Mother
Hmm.
was taken to the cardiac cath lab for angiography, but she was not willing. She was saying that no, this is not the time. I'm not ready. And the doctors convinced her, and she was taken to the cath lab. When the procedure was about to start, on the cath table, she developed shivering and rigor and high fever. Obviously, the procedure could not be done. She was brought back. She
Mhm.
said, I told you it was not the right time and I am not ready for it. So you will do my angiography when I tell you.
Okay.
And when was that? Maybe a couple of days, or I don't really remember, maybe a few days later, 4 o'clock in the morning. She said, this
Okay.
is the time I have to have my angiography for at that time. So everyone was rushed again to the hospital, 4
Okay.
p.m., silent, no people, the press. The
Yeah.
press will always come when such a popular figure is admitted in the hospital, especially in Kolkata. She
Yeah.
was such a prominent figure. So the
Yes.
press, 4 a.m., nothing, no announcement, nobody was there. And it went on smoothly. It went on smoothly. She had angiography followed by angioplasty, and she was brought back to the room. And at the time of the discharge, she was actually running down the steps.
Wow.
And after she went down the steps, she held a press conference. The whole publicity was there, of course, in our conference room. She held a press conference. So that is her power of intuition, or the power of the higher spiritual order. I don't know, but she had said that time. She said, "This is not the time. I'm not ready, and I will tell you when." She chose the time. So this is a message also to not only Mother Teresa, but to the general patient population, that we are talking today so much about engaging the patient. How many times do we ask the patient,
Hmm.
are you ready for something? Or would you like something to be done now? We don't do that, not at least not very often, unless
Yeah.
it's a very VVIP, or, like for deliveries, they choose the date and time, which again is not for a normal delivery, of course.
Right.
So, yeah, but this is a good message to everybody, that engage your patients and see their mental preparedness and readiness for anything that we are.
Yeah, that
So,
that I think is what we talk about patient engagement. I mean, we all put very fancy words. I think it just boils down to literal engagement of the patient, which we tend to forget. Like you said, there are a lot of indicators we track. We make these fancy indicators, fancy data sheets. But I think there's just one question that the patient has to answer: did they really like staying in the hospital? Did they get what they wanted to? So that is a very, very beautiful, beautiful story, ma'am. Thank you so much for sharing those details with us. Moving on to our next question, ma'am, and this is something that I ask every nurse leader because that's the whole theme of the show, making nursing visible. We know that nursing remains a backbone of the healthcare. Everybody during Nurses Day will say that the nurses are the spine of the hospital and they are an important resource. Everything, yet our profession lacks visibility post Nurses Day, and the recognition that it deserves is, just slowly falls down. Like we did for COVID, we all clapped hands, and then gradually again, it's gone back to what it was. So, what key steps, in your opinion, with your all about 5 decades of wisdom on nursing, what do you think what we can do to enhance the visibility of nursing and the influence of nursing as a profession, not just in India but across?
stop behaving like the backbone.
Wow.
We are not the backbone, we are the whole system.
Okay, that's
We
brilliant.
are the whole system. Right from the time the patient is admitted, who meets the patient first? It's the nurse who does the initial assessment. Up to the time of discharge, who sends the patient out of the hospital? It's the nurse. If a baby is born, it's the nurse. If a patient dies, the last care is given by the nurse. We are the whole system. We are not the backbone. The backbone, the spine is not visible. You see my face. Are you able to see my spine or my backbone? No. So if we think we are the backbone, we will remain invisible. Stop being the backbone and be the whole system. I feel that the nurse is a queen in the hospital, or a king. You have to behave like one. I tell all the time, I tell nurses where I talk to them, that from the rooftop to the ground, anything in between in a hospital is our responsibility. Because we are at the bedside. If the patient hasn't got the diet, we have to communicate that the patient hasn't got the diet or has received the wrong diet. If the ventilator is not working, we just cannot wash our hands off saying the biomedical engineer will come, and yes, he will come. But unless we react, Unless we take it up, we call them. So it is indirectly, it is our responsibility. If there is a crack in the ceiling, we are waiting for the civil engineer when he will come for rounds to look at it. We are giving risk to infection.
Right.
It's my unit. It's in my house. What do? Do I wait for the plumber to come and repair the leaking tap? No. I call the plumber and I tell them, look, my tap is leaking, you come and repair. Same applies to the hospital. We are the queens in the hospital. We need to behave like queens. So if we keep saying, and backbone, then we will never be
The
visible, is what I think.
backbone.
We have to be the face, the front face of the hospital. And we have to behave that way. We have to be that much knowledgeable. We have to be that much confident. We have to communicate with our patients with that confidence that they will seek us for information rather than always depending on the medical professionals. That's my take. I don't know how many will agree with me.
Very beautiful, very different take. This is the first time I've heard stop being a backbone. And I think that would be the important message of this show, ma'am. Yes, you are. I mean, that is really a very thought provoking sentence that you've said. Stop being the backbone. If you be the backbone, you will remain invisible. Start being the face. And I think that should be the new mantra. Start being the face of the hospital. Uh, that is what I said. The wisdom that you hold in so many years of nursing, I think that is what is coming out. And thank you for putting that point across, ma'am. A brilliant one, a very, very brilliant one, I would say. Um, so on that note, now we are going to move on to the next section called as a rapid fire. I'm going to shoot some questions, and whatever first comes to your mind, ma'am, you can just answer to that. All right, so here we go. um, if not a nurse, then what profession do you think you would see yourself in?
Well, a very rare thing is that I chose nursing. Right from the time I had to choose a profession, I chose nursing. So I
Okay.
don't think of an alternative. But if you ask me, maybe I would have been a professional dancer
Really? Wow.
because I never learned dancing. And that's one thing I regret, that I never learned, classical dancing or professional dancing. And I love dancing.
Oh, I didn't know this side of yours. Oh, wonderful, ma'am. So hopefully, we'll see you taking up something. Not too late, ma'am. Taking up something to learn.
Try learning Bharatnatyam at the age of 50.
Mm-hmm.
Yeah, I did a few basic learning, but then that got stopped again.
Oh, oh, wishing you all the best, ma'am. I'm sure you'll take this up. You're a person who knows to do everything that you want to do, so I'm sure you'll take it up very soon. The next question: what advice you would give to your younger self?
Don't try to be a perfectionist and don't react, respond.
That's very, very wise advice, ma'am. One advice you'd give to the nursing leaders.
Don't hold on to your chair thinking that no one else will be responsible. From the day we become a leader, it is our duty to groom the next in line. Grooming and preparing leaders is the responsibility of the current leader.
Absolutely, successive planning, ma'am. That's why when you say that there were, I mean, the earlier days we had nurses who were very strong and very important personalities. I think somewhere gradually we need to restart grooming our next generation of leaders in the similar manner. Absolutely. One advice you would give to the young nurses who probably want to pursue nursing or are into nursing.
Well, I would say that look within yourself. Nothing is greater than our conscience. Work with your conscience and stop using the word workload. Loads are carried by donkeys. We are professionals. It's work joy. Once you start enjoying your work, you will see through everything. Commitment is what is required.
Absolutely, ma'am.
Commitment.
That's a brilliant point. Work joy. That's another highlight of our show here. What's one nursing myth you wish to, bust once and for all?
Yeah, that nursing is a noble profession and that nursing is the backbone of the hospital.
Now I'm certainly with you on this, ma'am. You've convinced me to be with you on this. Now, we've known to be a brilliant leader, very knowledgeable, efficient, very competent, a person who speaks out her mind. So, if your leadership style had a theme song, what do you think it would be?
I don't know if you have heard of a Bengali song which was popularized when Amitabh Bachchan sang it.
Mm-hmm.
It's written by Tagore. In Bengali, it is Jodi তোর ডাক শুনে কেউ না আসে তবে ekla cholo re. To translate it, it is that if nobody hears you calling, go ahead and walk alone.
I have heard that song, ma'am.
You've heard that song.
That yes, ekla cholo be.
Ekla
That is
cholo. Yeah.
yes, just lead the way. Wow, that really gave me goosebumps actually. One motivational quote that inspires you to continue this journey of yours with so much of enthusiasm that you bring every time.
I have always liked, people have controversies now, but Gandhiji's words, don't expect anyone to do something which you have never tried or been able to do. And Gandhiji lived by that. So I also believe that if you expect someone else to do something, first you should have done it yourself and then ask someone else to do it.
I think
So-
that sums up your journey also as well. Because ma'am, I have known you by these words. Like when I think about Abanti Gopan, a lady who is very dignified, always in such saris. That's the image I always had, in such nice Bengali, well pressed saris. Okay, a person who speaks less but speaks very invaluable words. I've heard you as a person who started or gave the autonomy to nurses, especially in the cardiac unit where you started the first MSc program in nursing. And now when I hear about you, everybody looks up to you as a mentor, as a person who has led nursing through different changes. I think NABH also, when the NANI standards, they were called at that time, I think so, the Nursing Excellence Standards were put forth. I think you were also part of that whole endeavor. So this is what I've always heard about you. And I think that beautifully sums up the last quote that you said about Gandhiji. If you expect somebody to do something, first start it, lead the way, and then that really, really beautifully sums up, ma'am.
So today's language, it is called walk the talk.
Yes, absolutely. Yeah, nowadays generation wants everything in a very concise manner, so that's right, walk the talk. Absolutely. It's
Speak louder than words.
Yes, ma'am. But that's so true, and I think that is what we need to. I'm very happy that there is ANI and there are so many other platforms where nurses are able to speak out loudly. But I still do believe that we can, and we have a long way, and hopefully we get that more autonomy, more empowerment. And these nursing programs that are coming into picture now. If nurses are accepted as healthcare providers, independent practitioners back in our country. And this podcast is just one way of showcasing to our nurses. There is a lot of possibility, but it's just that we need to hold the baton and sort of move ahead.
I want to add, especially for the current nurses, communication is lacking severely. Nurse patient, nurses need to go and talk to patients, spend time. It's not just doing the work or doing the procedures. Even our whole exam system has become, education system is procedure. We are looking after human beings. So a lot of time, which abroad they do, this I think so they do still.
Yes.
We spend a lot of time spending at the bedside talking to patients and family members. That's
Yes.
one aspect we need to really look into and develop. And that comes when you are confident, you have the knowledge. Otherwise, what are you going to talk about? Exactly.
True, ma'am. That is absolutely true, ma'am. Yes, there's a mixture, like you say. There is a mixture here as well. I wouldn't say that all the hospitals here where nurses get ample time to. There are hospitals with heavy nurse ratios, which I've probably not seen in India as well. 1:11, 1:12. In some places, yes, it's much better. Depends from trust to trust. But when I said that, that nurses don't have to be accountable for others' actions. What I meant was this, like, yes, she will raise a point if something is not provided to the patient, but the accountability is held on the person who is supposed to do the job. And that's what happens, is it releases the nurses to spend more time with the patient. So I do see nurses talking to patients, right from not just clinical things, but also, like, when is their next vacation held, what are they going to do about it, so I feel, yeah, that communication is really important, and somewhere those are the soft skills I think will gradually start building in our nurses as well, which will help them to engage. Again, we're going to that word, engage with our patients in a better manner, ma'am.
Point, NABH.
Yeah.
NABH is one body which gave equal status to all professionals, nurses, doctors, administrators, or technicians, or whoever it is. Everybody got equal status, and the hospitals had no choice but to accept, because there are so many principal assessors leading medicals in the NABH team. I also stopped as a principal assessor. So many principal assessors are nurses, and they are
Yes.
leading the whole team, and that has been accepted. So that
Yes.
is one body which has given very good visibility and status to nurses.
Absolutely, ma'am. I completely agree. I used to be, of course, now I'm here, but I used to be one of the principal assessors over there for the.
I think one assessment we were supposed to do together during COVID, but somehow that got cancelled or something happened.
I
I
think so, ma'am. I have a very
don't
vague, yeah, I have a memory of it, and I was pretty excited back then. But yes, COVID happened, and everything just got, everything went online, and some of them got cancelled. But yes, ma'am, NABH, I think it really elevated the status of nurses and other professions as well. Because now, when we talk about assessments, like when I was leading accreditations back then in my organization, I realized that I wouldn't say backbone, but nurses were a major part of
Yes.
having a successful accreditation. About 70% of the work is done by the nurses, so based on which the standards are evaluated. So it really elevated.
Birla was one of the first hospitals to get NABH accreditation, and that time we already had set standards. Dynamic standard setting system. We had standards already in files,
Wow.
and Dr. Pawan Kapoor had come as the assessor, and
Mhm.
he said that he told the medical director that this is what even the doctors have to do. This kind of nursing. He was really amazed at the kind of nursing standards we have set up, structure, process, outcome.
I'm sure with you there, I'm sure it was all already put in, So everybody talks so heavily about you, ma'am. They have huge respect for you, not just the nursing fraternity, but the whole healthcare fraternity. And it's been my honor to have you on this show, ma'am, and speaking your mind out, no mincing words, straight to the point. And I will take this thought with me. If you have to make nursing visible, you have to be the face and not the backbone. So thank you so much for accepting the invite and being on the show, ma'am.
যদি তোর দাগ শুনে কেউ না আসে তবে একলা চলো রে যদি তোর দাগ শুনে কেউ না আসে তবে একলা চলো